Welcome to Ringwood Private. You can find us at 36 Mount Dandenong Road, Ringwood East. Ringwood Private Hospital has 75 beds and 2 operating suites. We admit patients 24 hours a day, 7 days a week. During your stay at Ringwood Private Hospital, you have the right to confidentiality and privacy, to have your doctor discuss proposed treatment with you and your family, to seek a second opinion, to be informed of the costs associated with your care, and to know your continuing healthcare needs upon discharge. Please provide us with accurate and complete information about your health. Always report unexpected changes in your condition. Ensure you understand and agree to your treatment and follow your treatment plan. Other services at Ringwood Private Hospital are Ringwood Cancer Centre, Rapid Access Breast Clinic, Skin Cancer Clinic, Lymphedema Clinic, Inpatient Gymnasium, Hematuria Clinic, and Massage Therapy. We also have counselling services, cancer support groups, Cancer Support and Wellbeing Clinic, radiology, radiotherapy, consulting suites, and a hairdresser. Visiting hours are 3 p.m. to 5 p.m. and 7 p.m. to 8:30 p.m. daily. Other times by arrangement with the nurse in charge. Ringwood Private Hospital uses the services of HPS Pharmacy. A pharmacist will come and see you soon after admission and ensure that all your medications are in order. Feel free to ask the pharmacist any questions you may have. Breakfast is at 8 a.m, morning tea at 10 a.m. Lunch is at 12 noon and afternoon tea at 2:30 p.m. Dinner is at 5 p.m. and supper at 7 p.m. %3% of people over 65 and 50% of people over 80 fall at least once in a year. In Australian hospitals, 38% of patient incidents involve a fall. Our Falls Prevention Program aims to reduce the number of falls and improve patient safety. You are in a new and unfamiliar environment and are particularly vulnerable when you are unwell or recovering from an operation. These factors contribute to your risk of falling in hospital. Help us keep you safe whilst in our care. Ensure you have footwear that fits securely and that they have flat, non-slip soles. Sometimes the medication you take can make you feel confused or dizzy. If you've been asked to walk with assistance or you need assistance, please ensure a nursing staff member is with you when you're getting out of bed, going to the toilet or bathroom. When in hospital, your risk of having a blood clot in your legs or lungs is higher than normal. Having had an operation, other injury, or resting in bed, you're normally not as mobile as when you're at home. Blood clots are a problem because they can restrict blood flow or become more serious and cause serious issues like a stroke. The prevention of blood clots is usually treated in two ways. Your doctor may prescribe a blood thinning medication either orally or by injection, and using devices such as compression stockings that help blood flow in your legs or compression devices that mechanically compress your legs. These are commonly used after surgery. What you can do to help? Keep moving. Try and stay as mobile as you can. If you can't get out of bed, give your legs gentle exercises. The nurse call handset includes controls for the television. If you require anything, please do not hesitate to call. At certain times of the day, nurses are in high demand and there may be a slight delay. Why do we check your identification band all the time? We need to ensure that we're giving the correct patient the correct treatment. Ringwood Private Hospital offers patients extensive access to allied health professionals. Your doctor or nurse will refer you to a physiotherapist, dietitian, speech therapist, or social worker if needed. We want to ensure you have the opportunity to give feedback and be involved in all aspects of your care. Feedback forms are available in your room or from the nursing team. Ringwood Private Hospital has 2 consumer consultants who are members of the community. They are actively involved in improving the quality aspects of the hospital. Each nurse involved in your care needs up-to-date information about your status and treatment. This communication occurs during each shift through handover. Wherever possible, nursing handover occurs at the bedside so that you can be involved. You can ask questions and ensure you understand what is going on with your care. If you wish, relatives and carers can also be involved. Hourly rounding means a staff member will check on you at least every hour. During this time, the nurse will check your pain levels and administer pain relief if necessary. Ensure you are comfortable and ensure you have everything you need within reach. Check if you need the toilet. Answer any questions you might have. We will not wake you if you are asleep unless there is medication or observations due. Please ensure you have an accurate list of all medications with you to discuss with your doctor. During your stay in hospital, qualified nursing staff will administer all of your medication. Please ensure you do not self-administer any medication. Nurses and doctors need to be aware of all medication you take to better manage your condition. If you require a blood transfusion, your doctor will order a blood test to ensure that your blood type is properly matched to the blood that you will receive. 1 unit of blood normally takes 2 to 3 hours to transfuse. Blood products such as platelets are transfused over a shorter time, usually 20 to 30 minutes. During the transfusion, the nurses will closely observe your heart rate, blood pressure, temperature, and general condition to ensure that you are okay. Please report to nursing staff if you notice any chills, fever, shortness of breath, or a rash. You may recognise a worrying change in your condition or that of your loved one. Raise concerns with staff on the ward as soon as possible. Speak with the nurse caring for you. If your condition or that of your loved one is deteriorating rapidly, you can activate an emergency by calling the nurse in charge on the extension number indicated on your communication board, or pressing the Staff Assist button located next to the patient's bed head. A pressure injury is an area of skin and sometimes the underlying tissue that is damaged due to unrelieved pressure. Pressure injuries can be painful and prolong your recovery. What can you do to help? Change your position slightly every 20 minutes. Staff will assist if you need help. Special equipment can help, such as air mattresses and foam heel pads. Keep your skin and bedding dry. Eat a balanced diet. Notify staff of any soreness over bony areas or any reddened or broken skin. Staff will discuss with you a plan of management to prevent pressure injuries. The top 5 infection control tips for your stay at Ringwood Private are: wash your hands. Do your duty by washing your hands, or at least using a hand alcohol gel that doesn't require water, every time you use the bathroom. Don't handle anything that might be a germ carrier, such as tissues or cloth hankies. Ask away. Don't be afraid to ask your healthcare worker, your nurse or doctor, if they have cleaned their hands. Food safety. Make sure that if anyone brings cooked food into hospital for you, it comes in sealed containers that have been carried in an esky or cold bag and placed straight into the fridge. This could prevent you from getting food poisoning. Cough etiquette. Remember to cough into your shoulder and put used tissues straight into the bin. Remember to wash your hands straight after. Immunisations. This is one of the most important things you can do to prevent spreading infections, such as seasonal influenza. Remember, flu can kill. 5 moments for hand hygiene. Before touching a patient, before a procedure, after a procedure or body fluid exposure risk, after touching a patient, and after touching a patient's surroundings. Discharge time is 9:30 a.m. Please discuss with the nurse in charge if you need to be discharged at a different time. Please give any feedback about this video information to any of our staff. If there is anything we can do to help you during your stay, please let a staff member know. We are here to make your experience a positive one.